Thank you. It's indeed an honor and pleasure to be here this evening on this very important occasion. And I want to begin by thanking Pravesh. I've had a lot of discussion with him over the last 2 years since we've come into government. And I must say that I am extremely delighted, extremely happy with the vision, compassion, and the drive and energy that he has, not only in terms of setting this Pacific Specialist Healthcare Hospital, but also engaging himself with new initiatives such as the Pacific Specialist Healthcare Foundation that we are going to launch today. I'm also very delighted to see so many familiar faces, friends, prominent citizens of Nadi. Thank you, Legalega Road, for coming over. Before I talk about the foundation and the hospital itself, let me just say that when we came into government, one of the key issues or the key challenge that we as a government wanted to address was the issue of health. And it was partly driven by my own assessment of having been in opposition for 8 years and looking at our health infrastructure around the country, and having looked at the health outcomes that were being put out to our people. So I asked the World Bank, Ministry of Finance, and asked the World Bank to do a major review of our health system in the country, because we wanted to know very clearly, in a transparent and an accountable way, the state of our health in the country. Because if we said on our own, people would have said we wanted an independent assessment of our health system. So the health review report was launched on the 27th of November by the Honorable Prime Minister, and the report titled Mo Bula Bula Ka Bula Bala. The idea of that title for the report, and those who understand the meaning, was essentially to drive better health outcomes for our people. The report is available online, and if you read that report, what it says that our health outcomes in the 1970s, in the 1980s, and in the 1990s were better than the health outcomes that we see today. And it also says, apart from the health infrastructure, it talked about the number of people affected by non-communicable diseases, NCDs. And it's a very sobering report that is available, and I'm sure many of you would have read it. What it also showed is that we were spending a lot of money, so the pyramid turned upside down. Normally, government spend a lot of money at the primary care, providing better services, better public health delivery, so that lesser and lesser number of people end up in hospitals like this. Hospitals like these are very important because there will always be people who need that treatment. But the number of people that have reached that stage in Fiji is quite alarming. So we are now working very carefully in terms of our health budget. Some of the delivery is not as efficient, not at the speed that we expect it to, but we are putting in a lot of effort in doing that. We also got the Australian government to do a master plan for the CWM Hospital, review the state of the hospital, and the work on CWM Hospital has now begun. We have improved a number of health centers around the country. I said this in Parliament. I was in Kandavu recently, a couple of months back on a visit, and I went to Bunisea Hospital. And virtually the hospital was falling apart. I met two doctors who were from Legalega. I said, "How do you work here?" They said, "Sir, we are staying here, we're working here because we just feel for the people." And that hospital is now being fixed. So I was just wanting to give you some examples of where the government is. We are also talking to the development partners, World Bank. There's a study already been done for a new national hospital. CWM will be a major hospital, but we'll see a lot of transition into a new hospital. We've got the Indian government to build a super specialty, 100-bed super specialty hospital in Suba, Asimu. Work on that is going to begin soon. And that highlights the additional facilities that are coming up. And I'm very pleased to say, and I want to commend Pacific Specialist Healthcare and Pravesh and everyone involved in this in elevating the quality of health services, and particularly tertiary care in Fiji. I know the hospital's strategic location near the international airport is going to make it convenient for medical tourists, retirees, and enhancing Fiji's reputation as a destination for comprehensive medical facilities. We have talked about medical tourism, retirement homes in this country for many years. And I'm very confident now with the addition of medical facilities and the tertiary care that we are going to provide through hospitals such as Pacific Specialist Healthcare is going to add to the impetus for the drive for further investment in the area of medical tourism, retirement homes. This is state of the art, and I know that continuous work is being done. 130-bed specialty private hospital. And as Pravesh said, since its inception in 2016, the hospital has been making significant achievements, delivering essential primary care services, including low-cost GP consultations, routine diagnostic tests like ECGs, chest x-rays, full blood counts, as well as preventive health screenings. And I know also that you offer a range of surgical specialties, which include gynecology, urology, plastic surgery, and orthopedics. I'm also informed that the Pacific Specialist Healthcare has successfully commissioned a multi-million-dollar cardiology department and operations theatre and is already managing complex surgeries like brain tumor operations. So the foundation aims to provide free or heavily subsidized complex medical procedures for the poorest of the poor in Fiji and across the Pacific. And I think this is very commendable. And as a government, and as Minister of Finance, I have said this all along, right from the beginning, that government has to work with the people outside of government. There is a lot of knowledge, wisdom, experience, and the drive and energy that people have outside of government that reside, people like yourselves, the private sector, in religious organizations, in NGOs, and part of our strategy as a government is to harness that wisdom, that knowledge, that experience, so that we can work very closely with them to provide services such as those that you are planning to do so. I know you are also looking at cancer treatment. Cancer in Fiji is responsible for about 11% of total deaths. And unfortunately, 30% of deaths are cancer related and are mainly attributable to lifestyle factors. And I know that the new planned radiotherapy treatment by the hospital will help better treat Fiji's cancer patients and avoid patients having to spend significant amounts of money to be treated overseas. And as we said, there are a lot of people who find a lot of difficulty in making sure that they get the resources and the support for those kind of treatment. So I'm very pleased, and in fact I want to commend the hospital for the approach that they are taking in engaging proactively with the local stakeholders, including the participation of our community leaders in Fiji and the Pacific. And this manifests the organization's respect for our community leaders, our chiefs. I know the agreement with the Great Council of Chiefs is also very significant. It will address some of the hidden health issues that usually do not come out because of cultural and other impediments. And that will lead to better outcomes for our Itoke and Rotuman communities and create positive relationships with those organizations. I want to commend the other religious organizations, Sri Sanatana Dharam Pratinidhi Sabha of Fiji, Arya Pratinidhi Sabha of Fiji, the Fiji Muslim League, the Fiji Council of Churches, and I want to commend all of you for taking part and being part of the compassion and the drive to help ordinary people who cannot make ends meet in the area of healthcare. I know that you are also making a strong commitment, providing GP consultation fee of only $7.50 per visit to access world-class medical services at discounted rates and easy payment options to faith-based and cultural organizations, including members, which is indeed, again, highly commendable. As I said, the government is very pleased to support this initiative, and we are committed. In fact, in the last two budgets, we have made sure that some of those organizations, such as the Fiji Cancer Society, the WOW Kids, and many other professional non-governmental organizations that have ventured out, that have provided support to our people over the years, that the government also puts in additional support to those organizations. And I can assure you that we will consider some support in the next budget, which will be delivered on the 27th of June. As I said at the beginning, the government is fully committed to ensure that we improve our health outcomes in the country. The report also said that a large majority of the people, by the time they reach the age of 50, their productivity is almost half to 50%. And that's not something that will be good for the country, good for our economy, and good for everybody. We have taken decisive action as a government to address the issue of NCDs. Our goal for the health sector in our National Development Plan 2025 to 2029 is modernizing Fiji's healthcare system to reduce disease incidence and enhance service quality. We will be prioritizing in the national budget resourcing our primary and preventive healthcare, curative services, specialized services, public health services, and also looking at efforts to improve service delivery by reducing patient waiting time, enhancing hospital services, increasing the number of hospital beds, and improving ambulance services. And there is also a need for more equitable geographic distribution of doctors, particularly in rural and maritime areas. We have as a government indicated on many occasions, and I want to reiterate what I said at the beginning, that we want to partner with our private sector and non-governmental hospitals, and we would be very, very pleased to continue that collaboration with the Pacific Specialist Healthcare. So once again, I want to applaud and commend the Pacific Healthcare Hospital for committing to provide this support to our people. I call it the poorest of the poor in Fiji and across the Pacific. This is very highly commendable, and I want to thank all the organizations that are part of that. And thank you, ladies and gentlemen, for getting up in big numbers to support this initiative. And once again, I wish the foundation all the best, and be assured that government will provide support towards the foundation as well. Nakabakaleu, Dhanyawad, thank you.
Ladies and gentlemen.